Welcome. This short video will walk you through the simple steps for correctly using your Aerospan flunisolide inhalation aerosol inhaler. Aerospan is an inhaler unit made up of three parts: the purple inner part, or the actuator, the metal canister of medicine, and the gray outer part, or the spacer, which includes the mouthpiece through which you inhale the medicine. Do not separate the actuator from the spacer. Do not use your Aerospan inhaler with any other actuators, canisters, or spacers. You must open and position your Aerospan inhaler before using it. To pull the actuator out from the spacer, gently pull on the lip at the top of the actuator. Check the mouthpiece for foreign objects and snap your inhaler into an L shape. Make sure that the guidelines on the actuator and the spacer match up, and that there's no opening at the top of the unit where the actuator and spacer come together. Your Aerospan inhaler is ready for use when the lines are matched up. Before you use your Aerospan inhaler for the first time, or if you've not used your medicine for more than 2 weeks, you'll need to prepare or prime your inhaler. Holding the inhaler between your thumb and index finger, check to make sure the canister of medicine is placed fully into the actuator, and shake the inhaler. To avoid spraying medicine in your eyes, point the mouthpiece away from your face. Press down on the metal canister of medicine 2 times for 1 second each in order to release 2 test sprays into the air. When you're ready to use your Aerospan inhaler, hold it between your thumb and index finger and shake it. Stand upright with your neck and head straight. Hold the inhaler with the mouthpiece facing toward you. Breathe in and breathe out normally through your mouth. After breathing out, bring the inhaler to your mouth and hold the mouthpiece firmly between your lips. Start breathing in slowly. While breathing in, fully depress the metal canister of medicine with your index finger for at least 1 second. Continue to breathe in through your mouth for 3 more seconds. It's important to begin breathing in through your mouth right before pressing down on the canister. This helps you get the right amount of medicine. After 3 seconds, remove the inhaler from your mouth. But do not breathe out yet. Close your lips and hold your breath for at least 10 seconds, or as long as comfortable. Then breathe out and breathe normally. If your doctor's prescribed 2 or more sprays or inhalations at each use, wait 20 seconds, then repeat the process. To close your inhaler, snap the actuator back to the straight position and gently push it back into the spacer. Rinse your mouth thoroughly with water and spit it out. You may also want to brush your teeth. If your mouth becomes sore or you get white plaques in your mouth, tell your doctor, but do not stop using your inhaler unless your doctor tells you to stop. Use a checkoff chart to keep track of the amount of medicine you've used. Shaking the canister will not tell you how much medicine is left in your Aerospan inhaler. Throw away your entire inhaler, including the canister, actuator, and spacer, after you've completed your checkoff chart, even if the canister isn't empty. You may not get the right amount of medicine in each spray if you continue to use your Aerospan inhaler. Never place the canister underwater in a float test to find out the amount of medicine left in the canister. Each time you refill your prescription, you'll receive a new Aerospan inhaler and should throw away the old one. Be sure to read the instructions that come with your Aerospan inhaler. You can also talk with your pharmacist or healthcare provider.
Aerospan inhalation aerosol is used for the long-term maintenance treatment of asthma to control and prevent symptoms in adults and children 6 years of age and older. Do not use Aerospan to treat symptoms of an asthma attack. Always use a fast-acting bronchodilator rescue inhaler to treat sudden symptoms. Do not use if you are allergic to flunisolide or any of the ingredients in Aerospan. Aerospan may cause serious side effects, including fungal infections in your mouth or throat, increased risk of infection, decreased function of the adrenal glands, decreased bone mass, slowed growth in children, eye problems such as glaucoma and cataracts, and increased wheezing. These are not all of the possible side effects of Aerospan. Common side effects with Aerospan include sore throat, runny nose, headache, nausea, sinusitis, and increased cough. Use as instructed. Talk to your healthcare provider about any questions you may have about Aerospan. For more information, visit www.aerospanrx.com. Call your healthcare provider for medical advice about side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088.